I'm Dr. Equilibrium. Yes, I'm here for the home visit. Perfect. Oh yeah, I know that most people don't want to come into the clinic because, there's so many sick people and it's so easy to get sick, even if you're already sick. It's a nightmare to get sicker, right? So I completely understand. Luckily, we do have the home-based treatment, so we are very fortunate for that. So, if you want to just run with me a little bit, what are you experiencing? I know that you told the receptionist on the phone that you were feeling just very loopy and you didn't really know what was wrong. So a lot of symptoms that have come on suddenly and you don't really know the cause, okay? Yeah, it's completely understandable that you'd want to see a doctor right away for that. So how long have these symptoms been going on for? Okay, so since last Friday. I'm just gonna check your file while I ask you some questions, okay? Before we get started with the physical. Okay, so just rest easy and we'll figure out what's going on wrong, okay? Okay. So, I'm looking up your file right here on my computer, and it says that your last physical was in July of last year. Okay, so we are heading up on July now. If you can, just for me, confirm your name and your date of birth. Okay. Okay, I found you here, yeah. So, you have no family doctor right now at the moment, right? Okay. Just, you're just seeing walk-in clinic? Okay. Just gonna write that down here, just for our files. If you do need a family doctor, our practice is accepting new patients, okay? So just rest assured. I know it can be quite a challenge to find a family doctor, so. Okay. So I'm going to be asking you some questions, if that's fine, right? Okay. So, do you exercise on a daily basis? No, okay. Do you smoke? Okay. Are you, what is your diet like? So it was good before you were sick, and now since you've been sick, you've had a lack of appetite. Yeah, that makes sense. How have your sleeping pattern habits been? So you wake up in the night quite often? Okay, even before you were sick? Okay. That's very interesting. Okay. Yeah, it says here in your chart that you've been having some sleep problems for quite some time now. Yeah. It's very common. Yeah. Do you take anything for that? Like melatonin or anything? No? Okay. It's perfectly okay. Don't want to take anything for it. On a scale of 1 to 10, how would you rate your mental health in terms of happiness? I know it's a very vague question. Yeah, just because depression can cause a lot of physical problems, anxiety. Okay, so you're not unhappy, but you're not tremendously happy. Okay, I understand. Yes. You don't think the two are related. Perfect. When was the last time you saw a dental practitioner? Okay, so a year and a half ago. Okay. And do you have any family history of cancer, anything like that? I know it can be a touchy subject. Okay. Have you traveled out of the country anytime recently, within the past 6 to 12 months? No? Okay. And have you been in contact with anybody that's traveled out of the country? You have? Okay. And where did they travel? Okay, Ireland. Okay. Just looking over everything here and seeing if I want to assess and question anything else, because that's important to do, right? Okay, I think we're good. Okay, so I'm just going to do the basics at first and go from there, okay? So just relax, everything will be okay. I know how awful it is to be sick, especially during the summertime. Yeah, absolutely. These gloves are a little bit too big for my liking, but we'll make it work. So, I'm first going to check your heart rate and your pulse, okay? And I also want you to take deep breaths in for me and hold them, okay? So I'm just checking the heart and the lungs. You said that you're having a little bit of fluttering in the chest. Okay, I'm just gonna warm this up for you, okay? Okay, if you could just lift your top up a little bit for me. Okay, thank you, sweetie. seems okay. And your chest sounds okay. Doesn't sound like there's any sort of problems going on there. It sounds it's all very clear. Yeah, that's not your problem. No, it's not your problem. Okay. So we're just gonna take a look in your eye. Okay. So if you could just, okay, if this hurts, please do let me know, okay? Just keep your eyes to the back of the wall, hun, okay? Okay. Let's give it a second here. We're going to get my instrument. We are going to cover that eye up again, the other eye. Your right eye. And we are going to take a look. And see how the pupil dilates. Okay. And then we're going to check the other eye. I'm coming in from the side and just checking to see if everything's okay. Okay, so your pupillary reflexes seem totally normal. Yeah, I don't see any problem with it at all. Okay, I'm just gonna take a feel around your scalp, and I'm just gonna feel around your face and in your glands. Okay. I'm sorry, my ears. I'm sorry. Okay, yeah, just hold your head steady. And could you clench your jaw? And yeah, bite down. Can you smile? Okay, make angry face. Like you're really angry. Okay. Is there any tenderness or pain up here? A little bit? Okay, so near the sinuses. Yeah, you said that you've been having some headaches there, right? Right. Okay. So. Okay. And can you just swallow for me? And I'm just gonna feel your throat. Nice big swallow. Perfect. Seems fine. Just gonna check your neck. Back of your neck. Okay, seems, yeah. Yeah, your glands are swollen, but your neck is not, yeah, your neck's fine. Yeah. I already have an inkling suspicion that you have a sinus infection or a bacterial one. There's bacterial and there's viral sinus infections, so I'm kind of leaning towards that right now, but we're not finished, so we'll just keep looking and we'll see. Okay, so we're just going to check down your throat and to see if there's any post-nasal drip or anything like that, anything bad, to see what your tongue looks like. This is my tongue compressor here. So if you could just go, stickle your tongue. I'm just gonna look inside here with my light. Okay. Everything seems fine. Can you just go, yeah, okay. Again, it is a little bit strange, isn't it? Okay, the back of your throat looks a little bit red and inflamed. Yeah, have you been coughing? Sore throat? Okay. That definitely makes some sense. So I'm just going to get you to just relax and just sit still. And I'm just going to do some tapping on your chest, okay? Okay, this is to check if there's any fluid in the lungs. Okay. Okay, it seems okay. Okay, so I'm trying to think of what else you talked about on the phone. You said that, yeah, you had a fever. Yeah, so it's actually the fever has been going kind of wishy-washy. So you did check your fever, yeah, and you do have one, yeah, but it's like a low grade. It's not over 100, right? Okay. So what I'm thinking is that we will give you a shot and some medication, okay? And because I do believe that you have a sinus infection, just based off of the tenderness in your head. So when I press right here, yeah, that hurts. And how about right here, right underneath your eyes? Yeah, that hurts. Okay. You know what? I want to take a look up the nose. Okay. So lift your head up for me, hon. Okay. And if you could just breathe in with your nose. It looks like your right nostril is blocked a little bit, yeah. Okay. Yeah. Does your pain get worse at night or during a specific time in the morning or afternoon? Okay, so it's worse in the morning and it seems to gradually get better in the day. Okay, that makes sense. Have you been taking anything for it, like acetaminophen? Yeah. Okay, so you've been taking Advil? Okay. So, I'm going to give you a shot. Just give me a sec here. And, just looks like this. And we're also going to be giving you a prescription for antibiotics because I do believe that you have an infection, a pretty bad sinus infection. So what this shall do, hopefully, is help you get on the fast track with the antibiotics for better health, okay? Okay. So, I'm just going to lift up your sleeve, okay, hon? Yeah, you've had shots before, right? They make you a bit nervous, okay? We're gonna make it really fast and easy for you, okay? So, just gonna take off the tip here. If you could just give me your arm. Okay, pull up the sweater. We're gonna make a tight band around arm. If you could just make a fist. Okay, perfect. We're just gonna do it on the count of 3, okay? That'll be quick, okay? So 1, 2, 3. Gonna get a cotton swab, and if you could just place your finger on there and just hold it there with pressure. I'm gonna get a band-aid for you here. Okay, that wasn't so bad, was it? Okay, here's your band-aid. Your sleeve. Okay. Yeah, it's great to get to the bottom of health issues always. Can be very concerning with your health, of course. If something doesn't feel right. Okay, so I'm just gonna write down that we gave you a shot. Okay. And we're going to write you a prescription, for the antibiotics. And we could just get this filled out as soon as possible, okay? And your infection should go away within, say, 7 to 2 weeks to be safe. I know it seems like a long time, but these viruses, unfortunately, can be quite aggressive. So we'll just take our time here and make sure to get plenty of rest, okay? Okay, perfect. So, I hope you do feel better with the shot and the medication. If you don't feel better, do immediately contact me or another physician to get help. Do not end the treatment of the antibiotics before, because it can actually make it worse, okay? So, it's going to write down today's date, and everything we went through. Perfect. Okay. Okay, we're done. So, yeah, like I said, please contact me or a different physician if you're having any sorts of problems, okay? After the treatment's done, you should feel better in about, like I said, 2 weeks. So, okay? Okay, perfect. Okay, yeah, so you should feel better in about, like I said, 7 to 2 weeks, and if you don't, then please do contact me or a different physician, okay? Okay. So, with your prescription, just make sure that you do take it every day, okay? And at the same times that you're prescribed, and do not stop the medication unless, of course, you're having something like an allergic reaction, okay? Because if you stop the antibiotics, the infection can become harder to treat, unfortunately, okay? Okay, so just so we're clear with that, I was thinking of anything else I want to go through with you before I head out. Do you have any other symptoms you want to go over, or do you think that we covered it? You think that, yeah, sinus problem, yeah. Definitely makes sense with the symptoms you were experiencing. Yeah, so the pain in the facial regions, yeah. The fever, the lethargy, and yeah, the fatigue. Yeah. Okay. So, I do wish you a speedy recovery, and I'm so glad that I met you and was able